Rainier Avenue Radio. Your community radio station will provide you with more information. Rainier Avenue Radio.
Feel uneasy on your feet? Need assistance to walk? Do you use a wheelchair and want to stand more? What if you could stand stronger and feel steadier on your feet? What would this mean for your daily life and those closest to you? Join our dance-based walking program to improve balance, coordination, strength, and stamina. Wednesdays, May 18th to June 22nd at 2 p.m. at the iconic Columbia City Theater in partnership with Rainier Avenue Radio and Hugs That Empower nonprofit. Walkers, wheelchairs, and canes, welcome. If you can stand and bear weight for even just 5 seconds, come dance to walk with Tango Stride.
Greetings. This is your host, DJ Neftali, Rainier Avenue Radio World, the best DJ in the Seattle area. You can catch me every Monday at 8 p.m. on YouTube. Like I said, this is DJ Neftali, the best reggae in Seattle, Washington, the best radio station, Rainier Avenue Radio World. Come on, right?
This is your Rainier Avenue Radio World community update on education companies offering free subscriptions due to school closings. You can access a list of over 1,000 free education resources at www.amazingeducationalresources.com and also join the Amazing Educational Resources Facebook group.
This is Monique Lee from the Afternoons with Monique show. I'm also the owner of Seattle Love Broker, a relationship consulting and matchmaking company. Tune in every Thursday afternoon at 1 p.m. to listen to intriguing, informative, and entertaining guests share stories of their past and vision for the future of our community.
Are you a small business owner in Seattle who was impacted by COVID-19? The Seattle Office of Economic Development is investing $8 million to connect small businesses to operating capital. The Small Business Capital Access Program will lower the cost of Washington State Small Business Flex Fund loans by paying down 25% of the loan principal. Eligible small businesses can borrow up to $150,000 with a 4% interest rate to cover expenses like payroll, rent, utilities, and supplies.
You are listening to Rainier Avenue Radio World. Don't forget to log on www.rainieravenue radio.world.
You probably have questions about COVID vaccines. Here are some answers about how they're being made.
How are COVID vaccines being produced faster?
Usually, vaccine testing and production are separate steps. But because of the pandemic, vaccines are being developed on parallel tracks. So both steps are happening just at the same time.
How are the vaccines being tested?
Right now, several different COVID vaccines are in testing. Each go through multiple clinical trials with up to thousands of volunteers.
How do vaccines get approved?
Not all COVID vaccine versions will make it to the final stages of testing and approval. Produced vaccines that do not pass clinical trials will be destroyed. But for those that do pass, a team of medical experts will examine test results and possible side effects. If the vaccine is effective and safe, it gets approved and gets to you. Go to covidvaccinewa.org to learn more. A message from the state of Washington.
Good afternoon, and welcome to this week's edition of The Impact of the Coronavirus on South Seattle and surrounding communities. It's me, Tony B. Yes, we are doing this again. In the words of that great orator, Puffy, it don't stop. We will be again sharing vital information with you. Joining us will be Dr. Jeffrey Duchin. We're going to be talking about monkeypox, the new subvariant coronavirus, and then just general coronavirus updates and information as well. As we head into the summertime, we're going to find out where we are at with this thing. Before we do that, though, I just want to tell you we've got an exciting June coming up for you. A lot of things going on in June. I'll just quickly run by them. On June 3rd, we're going to bring to you a couple of basketball games from the Franklin High School Summer Slam. It's a high school basketball tournament with teams from essentially all over the country. And we'll be doing that on the 3rd. We're also going to be broadcasting live from the Doug Baldwin Barbecue, and that's on June 18th from 11 to 3. That's at the Renton Sports Stadium. So looking forward to that. That's going to be a lot of fun. Then June 19th, we will be broadcasting live from the Rainier Community Center Plaza, as we'll be bringing you a Juneteenth celebration that's put on by the Atlantic Street Center. So excited to be doing that. But wait, there's more. June 21st, yes, our very own Make Music Day celebration, which will be from all over the city, but we'll be primarily broadcasting live from Pier 62 and celebrating Make Music Day Seattle with music of all kinds, lots of bands, funds, music lessons, and interactive, so you can get involved. And you don't have to be a musician. It's just about making music. We'll supply you with some noisemakers, whether those be boom whackers or harmonicas or drumsticks, something for you to use as a musical instrument. On June 25th, we'll be having what we're calling a soft grand opening. If you're unaware, the Rainier Avenue Radio recently acquired the Columbia City Theater, and that is our new home. And that is where we'll be having the stop opening. That's where we're broadcasting from right now. And that's just really exciting and looking forward to that. Join us on June 25th for our soft opening. We won't be having a real grand opening until 2023 because we're going to do some structural work, but we're really excited about our new home and being able to manifest what we do over the air physically here at Rainier Avenue Radio at the Columbia City Theater. All right, enough of that. Let me bring on our very special guest, Dr. Jeffrey Duchin. Dr. Duchin, welcome to the program.
Hey, it's great to be back, Tony. Thank you.
All right, good to have you here too. How are you doing?
I can't complain. I'm still healthy and working too much. Otherwise, no complaints.
Still working too much.
Yeah, the virus. The virus is my boss. Unfortunately, it's not a very, kind or understanding employer right now.
Well, we're going to get into that. Now, this is related or maybe unrelated or on the same scope, on the same page. We've been hearing about this thing called monkeypox.
Mm-hmm.
And for a lot of folks, that seems like, is this something similar to a coronavirus? Is it in the same category? Are they on the same team? Is it something completely different? Is this something that comes from monkeys? How do you catch it? As you see, I just got a bunch of questions.
Oh, yeah.
And so we're going to start off, I guess, with the first one, which is this at all related to the coronavirus?
No, it is completely and totally unrelated as far as we know. Monkeypox has been known since 1958. It's a disease that's naturally occurring in West and Central Africa. There have been outbreaks in that area. There have been intermittent outbreaks elsewhere in the world since then. What's different now is that this is a larger outbreak in multiple countries, primarily in Europe, but also in Australia, North America, that is involving many men who have sex with men, although there have been others, household contacts who've developed infection in this particular outbreak. But the virus itself has been known for a very long time. It's existed way before COVID-19, and it's a completely different, unrelated species of virus.
Is this something we should be concerned? Everything, to some extent, we should have some, issue with. But Is this on the verge of being a pandemic? Is this something that really has the potential to again cause the problems that it caused in our society and wear down our health system and all of those things?
I don't think that monkeypox is going to result in anything like the COVID-19 pandemic, but it is something we should know about, and because it's, like I said, it's spread to a large number of countries now. It's international. There are over 300 cases. And now, you talk about COVID, we're talking about millions and millions and millions. COVID is a disease that spreads really easily. It's airborne. Monkeypox is not very easy to spread. I'll talk to you about that. But in the U.S., we have a relatively small number of cases recognized right now, 10 from 8 states. We have one case in King County in a person who acquired it during travel internationally. But this can be, monkeypox in most cases is a uncomfortable and unpleasant disease. It can last 2 to 4 weeks, but it's most people not severe. Doesn't lead to hospitalization in most people. Doesn't lead to death. I don't think there are any death. Well, I shouldn't say it doesn't lead to death. Doesn't lead to death in most people. Those who are most vulnerable, like many diseases, young children, infants, people who are immunocompromised, pregnant women. But it's a disease that nobody will want to get. I mean, it's very uncomfortable and lasts, like I said, 2 to 4 weeks, can spread to others. So we need to be aware of it, particularly if you have risk factors, like you've been traveling to one of those countries where an outbreak is occurring, or you have a new unexplained rash that is particularly one that's accompanied by fever or other symptoms, or if you are a man who has sex or intimate contact with other men, if you have contact or know someone else who has a suspected monkeypox, those people should be aware of this and should be evaluated right away if they have the symptoms of this rash or illness. But most people will not get monkeypox. This is not likely going to spread widely throughout the population. But it does need to be, stopped, and we do need to be on the lookout for it.
Now, I just want to have some clarity here about this being, because you've mentioned it potentially being a sexually related disease. So I'll just ask you, how do you catch monkeypox? How do you get it?
Yeah. So monkeypox is not, let me just say right up front, it is not limited to people who are sexually active or to men who have sex with men. Monkeypox spreads from person to person through close physical contact. And this primarily means touching skin, but it could also mean contact with saliva or prolonged face-to-face contact where you get little droplets from someone's mouth into your own mouth or eyes. It doesn't spread easily like COVID-19. So it's more prolonged face-to-face contact or that direct contact with the rash lesions, or it can also be spread by the pus or fluid from those rashes or scabs that get on bedding or towels. And then someone else touches those because the virus is in those fluids, or from sharing things like utensils or something that goes in the mouth of one person, then into the mouth of the other. So again, the direct skin-to-skin contact, contact with saliva of another person are the ways that this virus spreads.
Is there a vaccine that we should be aware of that we need to take for this? It's a two-part question. The other thing is, are there cures? Are there things that can be done to lessen the effect if you do happen to contract this virus?
Sure. Let me take one step back and then get to vaccines and cures and just talk a little bit more about what the illness is like.
Definitely.
Recognize it.
Yeah.
So basically, this is a rash illness, and the rash can look like chickenpox if you're familiar with that. It can start with little red spots that then turn into little blisters. The fluid-filled blisters, they can be anywhere on the body. In this outbreak, they can be in the genital area if there's been skin-to-skin contact with a case. who has sores in that area, but can also appear on the face, face, hands, mouth, genitals. It can be just one area or can be all over the body. Usually there's fever and swollen lymph nodes. Those swollen lymph nodes are kind of a clue, and they can be tender. The rash itself can be tender or painful or itchy. Headaches, muscle aches, low energy. So kind of like a flu-like illness with a new unexplained rash is something people should look out for, particularly if they've got the swollen lymph nodes. Now, vaccines. So monkeypox is very related to smallpox, which was a horrible disease that was basically eradicated in the 1970s through vaccination. And there are people who were vaccinated for smallpox many years ago who would have some protection, but most of those people would be older now since smallpox vaccine hasn't been used since the 1970s. We haven't had a reason to do that. And if monkeypox was spreading widely, there are vaccines that could be used in the community. The traditional smallpox vaccine, does carry a number of unpleasant side effects. So it isn't one that you'd want to give out unless it was really needed. But there is a newer vaccine that's given in 2 doses. And this newer vaccine does not seem to have any of the serious side effects that the older vaccine had. So it's more like, the usual fatigue, arm soreness, and so on, which could be used if necessary. But with the small number of cases now, and the fact that the newer vaccine is in relatively limited supply, it's being used for cases who have been exposed to monkeypox who are very high risk. So for example, someone who's been immunocompromised or a healthcare worker who for some reason didn't take the appropriate precautions and got a lot of exposure to a known case. There are also antiviral drugs that can be used for serious cases. That again in short supply, and in one particular one that seems to be most effective is not even commercially available. It has to be obtained through the public health folks and the FDA through an investigational new drug application. But the bottom line is we do have these vaccines and drugs. They're being used in small amounts now for these high risk cases, small number. And if we needed to use more of them, the government is purchasing more, so we can have it in the back pocket. But at this point, let's just hope we can manage the number of small cases we have to prevent their spread widely. We'll see.
Okay. And in the event, again, I don't know how fast this could spread. And again, you said it's not the same as the COVID-19, but in the event this were to get out of the box, are we prepared as a state to be able to handle an influx of monkeypox cases?
Well, Tony, I have to tell you, if you haven't already maybe read, the public health system and the healthcare system in general have been really stressed from COVID. Yeah. There's a lot, and so has the public. I mean, there's mental fatigue, physical burnout, a lot of turnover. People are running on fumes right now in the healthcare system and in the public health system. So that said, we still have a workforce. Monkeypox is a familiar pathogen in that we know how it spreads and sort of what to do to help limit its spread. We have the drugs and the vaccines, but it will be a stretch for the public health and the clinical community, the doctors and nurses out there, primary care physicians, for everybody to manage another large-scale outbreak while COVID-19 is still happening. It will be difficult. It will be a challenge. And as you know, the resources are going away that were devoted to the COVID-19 outbreak initially. Many of them are drying up. Federal government has not passed, a funding package for the pandemic response. And that's very worrisome to us in public health and to our clinical colleagues. So, let's just hope we don't go there. I think we'll rally if we do. We'll do what we need to do, and we'll do the best we can. But the public health system and the clinical health system is not really optimally resourced or funded, as we know, for large-scale public health emergencies, particularly those that last for years at a time.
Okay. I just wanted to talk about that because that was something that's been in the news. And, you know, if you don't get a chance to follow these things, people have questions and rumors get started. And so I'm glad that we had the opportunity to address this. Now, you talked about burnout and, you know, people that having, you know, just been tired of coronavirus, but the COVID-19 apparently don't care.
Yeah.
And there is a new subvariant. My understanding, this is worse than Delta, worse than Omicron, more contagious, and could be the next virus on the horizon. So help me out here. I don't know how much of what I know is rumor, fact. Should we be alarmed? I know everybody is tired of this, Dr. Duchin.
Yeah.
And we want to get back to some form of what we refer to as normalcy, or even move on to a new normal.
Yeah.
This new subvariant, am I close to right? Am I right? Is there something you can share with me? Are we? We'll start with that. Obviously, what I'm leading to is this summer going to be another summer of potential COVID-19 masking back up and closing back down. Get to the other stuff first.
Well, you're basically right, Tony, that this virus is evolving. It's continuing to try and outsmart our immune system and our vaccines and any protection that people might have had from past infections. So these more recent variants, the B1.12, B.2.12.1, and you hear about BA4 and BA5, the virus continues to get smarter. And what that means is it's better at dodging our immunity. The immunity we get from past infection doesn't hold up well in protecting us against the newer ones. And even if you're vaccinated and boosted, you can still become infected. Thankfully, if you're vaccinated and boosted, you have very good protection against hospitalization and death. And so the vaccine is holding up on that front, but it's not able to prevent all infections. So because these new variants that are circulating are so much more contagious, we're seeing record-breaking numbers of cases out there right now. And, you know, if you're vaccinated and boosted or vaccinated and infected, you have some good protection against hospitalization and death. But hospitalization and death is the most important thing to avoid. But there are other complications of COVID infection that you can get even if you're not hospitalized and dying. I'm talking about long COVID. And long COVID is real. It occurs only in a minority of people who get COVID infection. But when you're talking about so many millions of people getting infected, even a minority adds up to a lot of people who can have a long-term illness. It's like a chronic infection that can cause problems with the heart, the lungs, brain fog, difficulty concentrating, lack of energy. It can make it hard to work. It can make it hard to do things you like to do. So for that reason, getting vaccinated and boosted is really important to not only protect against hospitalization and death, but it also lowers the risk for long COVID, and avoiding infection, period, is really remaining to be really important, because you don't want to be one of those unfortunate small number of unlucky people who do get long COVID. So for that reason, and because there's so much COVID out there right now, we really shouldn't forget about this virus. And I think it's a very unfortunate reality that the virus is not going to go away. It's not something that, you know, we're going to find a cure for and it's going to disappear. We are minimizing and decreasing its impact with the vaccines, with the antiviral drugs, preventive treatments. If you're immunocompromised, we have available now. But still, this virus is causing a lot of suffering, and we need to continue to take steps to minimize that suffering of individuals, of families, and of communities. And so to decrease your risk right now, you really should still be paying attention to a number of things. First of all, making sure you're up to date on your vaccine doses, including the boosters, meaning both boosters if you're eligible, if you're 50 and older, eligible for that second booster, or if you're underlying immunocompromised, eligible for that second booster. if you're eligible for the first one, it's important to get it. Wearing a high quality face mask when you're in crowded indoor settings will lower your risk of getting COVID and also of spreading it if you happen to be infected and don't know it. Paying attention to ventilation. It's so critical to look around where you're indoors, make sure there's good airflow, windows and doors open. If it smells stuffy, if it feels stuffy, probably not good ventilation. And that means virus is just floating around in that air, most likely right now in our area. So ventilation, improving it, lots of advice on how to do that on our website. EPA has great information about improving ventilation. And then using testing. If you've got access to rapid testing, it's still being made available free in Washington State. You can order tests and also from the federal government. And if you're going into a group gathering, particularly if they're people who are high risk, like older adults or pregnant women, people who are weakened immune systems, you can test right before the event as close as possible to that time. And a negative test is a pretty good indication that you don't have a lot of virus in your nose and throat that you can spread to others. And a positive test means you do have infectious virus in your nose and throat, and you should isolate and take steps to protect yourself, get treatment if you're eligible, and try and avoid spreading infection to others. So, we need to pay attention to a whole lot of things right now to continue to decrease the risk to us as individuals and to the vulnerable members of our community.
And the home tests that we have available to us now, these are going to work on the subvariants that we can rely that these things may get smarter, but the tests will be able to identify them.
Yeah, the home rapid tests are working on the new variants just the same as they did on the other bugs. What is a little bit different now is that people may have symptoms for a few days before they test positive with the home test. So if if your symptoms start and you test yourself in the first 1, 2, even 3 days of symptoms and you're negative, that doesn't necessarily mean you're not infected. You should consider yourself to be infected with COVID until you get to test yourself on day 5 or 7, because if you've got some immunity from vaccine, or if you've had a past COVID, you may not even know it. That will delay the time to positive testing. It's because your immune system is reacting and making you feel sick before the virus has ramped up to the level that's detectable. So continue to test for every couple of days if you have symptoms, and try and avoid contact with others if you have symptoms that seem like COVID, because there's a good chance with all the COVID that's out there right now in the community, if you have symptoms of COVID, there's a good chance that is what you have.
I'm going to try and squeeze a couple questions in here, and we're almost out of time again already. Can you explain the difference between pandemic and endemic, and where we are with COVID right now in this scale?
Yeah, so in a nutshell, pandemic is a global outbreak that affects many countries, many people, and just spreads widely. And usually it's used in the context of God bless you. Usually it's used in the context of a new emerging infection. And so there's a lot of uncertainty. It causes a lot of death and disruption, or an illness and disruption, depending on the severity early on. And then frequently over time, we learn how to manage it and the impact becomes less severe. Endemic means basically a more predictable state. So it still can be widespread. It still can be global in scope. It still can be causing a lot of disease. But it may settle into a more predictable pattern, and that's what makes it endemic. It's something more like influenza. It causes annual epidemics. We sort of expect it each year at a certain time. We sort of understand the range of illnesses and hospitalizations and deaths that it will cause, and that's an endemic state. COVID-19, in my view, is still in the pandemic state because there's still so much uncertainty about how much illness and the severity of illness, how it's going to evolve and mutate with new variants. Will it evade our vaccines or will it not? We're going to continue, in my opinion, to see surges every so often as the virus mutates. That's why we need to really institutionalize and make all these prevention measures like habits and get used to trying to decrease the risk. But it's going to take some time for us to become into equilibrium with this COVID-19 pandemic, where it is a more predictable sort of problem, but we're not there yet. So not quite endemic, in my opinion.
Well, we're rolling into summertime, and I want to take these last couple minutes to give you an opportunity for any final words that you would just like to share with our audience, in addition to me asking about should we be concerned about summer and gathering and all that stuff. But if you can, kind of rope that into your final words. But I want you to share whatever you'd like to share with our audience right now. Again, all the things that you said. Yes, we're all tired of this. We want something back. COVID don't care. And anything that you'd like to say to our audience.
Well, I just want to start with a thank you to you, Tony, and to your listeners for being engaged in this discussion and for being interested in what you can do to learn about COVID and make good decisions for yourself. And I know everyone has been through a whole lot, and believe me, we're all tired of this. I just want to try and give people some hope that, we are going to get to a better place with this virus, but it's going to take time. Initially, we really all thought, we could sort of turn it around and put it in a box and sort of go back to our old lives. And, unfortunately, this virus is here to stay. It's not going to disappear. We're not going to get rid of it. It's continuing to challenge us in ways that we didn't predict. So over the summer, and I do hope we get more than one summery day in a row at some point. And that Doug Baldwin barbecue sounds really good, by the way. I'm going to check my schedule for that. But, over the summer and anytime right now, gathering indoors in particular still does pose a risk. And I just ask people to be aware of COVID, to understand that it's still in the community, that it's still disproportionately affecting people in certain parts of the county and in certain parts of the country who are not as highly vaccinated or who are at higher risk because of their work and have no choice about exposures to the virus, and to continue to take those steps that we know work. The vaccination and the booster, the masking with the high quality, if you can do the N95 or KN95 masks. Ventilation is so critical, and then testing when you can. I mean, all these strategies, they can be worked into our lives without being terribly disruptive, and they will make a difference in keeping us healthier and keeping our communities healthier. So it's going to be a long haul. But during the summer, we can do more outdoors, which definitely helps. And I do hope everyone has, a more relaxing and enjoyable summer. And I hope the virus gives us a break, but I don't trust it.
Thank you, Dr. Duchin. And again, this wasn't what the conversation was supposed to be about, but when you said long haul, I know some folks who are long haulers from COVID, and they are not having a good time at all with this. I know that's a whole nother subject to talk about.
Yeah. But it's a reason to avoid COVID infections. I mean, don't poo-poo it and think it's not, it's trivial and that most people are fine. It's true, most people are fine. But like I say, when you're having high levels of infection, when, we're talking about, in a group of 100, there can be several people infected that you don't know about. That's a lot of infection. And so, just trying to do what you can to decrease the risk that you will be one of those, unfortunate people in the minority that get affected with long COVID is really worth the effort.
Well, we went a little bit over time, but well worth it. Valuable information. Tried to squeeze it all in. Dr. Duchin, thank you so much.
It's great talking with you, Tony. Have a great weekend and happy Memorial Day.
All right. For those of you who are listening on our audio platforms, you just keep listening. If you're listening and watching on one of our visual platforms, switch over to Rainier Avenue Radio.world, and we're going to have more for you on the impacts of the coronavirus on South Seattle and surrounding communities. That's it. That's all the time that I have. Have a great Memorial Day weekend. It's me, Tony B, on behalf of Rainier Avenue Radio and the impacts of the coronavirus on South Seattle and surrounding communities, saying, remember, whether you believe you can or whether you believe you can't, you are probably right. I'm out. Peace.